Hey, Dr. Osborne here. A sexy health life is super important if you want to maintain great health and great relationships. We're going to be talking about all of that tonight, how gluten and other foods can impact and damage your sex life. So stick with me. We're going to be addressing that and much, much more right after this. Hey, so we're going to be talking about your sex life tonight. And I think before we dive into this taboo conversation, let's talk about why sex is important. Aside from the obvious biological nature of reproduction, right? We need to actually replicate and make new babies to propagate the species. That's a pretty important concept. But how can healthy sex life benefit you today in your life, in your health? So what we're looking at here are some of the well-known and well-studied benefits to actually having regular sex. So number one is lower blood pressure. There are a number of different hormones that are released during sex that can have longer lasting, not just short-term effects on blood pressure, but long-lasting impacts and effects. Improved cognition or ability to think, clearer cognition, improved immune function, decreased depression, decreased anxiety, an increase in libido. Again, healthy libido is healthy for you. Pain relief, which is a very interesting one. It's been a number of studies in the pain journals on those that have more frequent sex have a tendency toward less pain, and is also those with less pain want to have sex more frequently, right? So it's kind of a back and forth there. And then improved sleep, reduced overall perception of stress, and improved heart health. So these are some fantastic benefits that anyone would want to take advantage of, benefits to having sex. Now, beyond the benefits of sex, let's talk about how gluten, because we're going to get more into than just gluten, but let's talk about how gluten can impact your sex life. There's a couple of major studies that have been coming out here in the literature and the medical research in the last few years. And some of the things that we're finding about how gluten can impact sex are quite devastating, really, when you think about them. So let's look, ladies, let's look at what we know. So number one, gluten can cause sexual dysfunction in and of itself. And how does that manifest? It manifests as low desire, right? So the lack of desire for sex, arousal disorders, lubrication disorders, so vaginal dryness, which can lead to friction and pain, right? Inability to have an orgasm, as well as sexual pain during intercourse itself. So these have all been reported recently in women with gluten issues. And so again, gluten, this is before going gluten-free. These are major symptoms or major side effects that gluten is causing women to have during sex or in sexual encounters. Now for men, it's somewhat similar, a little bit different. We can see one, and some of these, and I point out this one here, this gonadal atrophy, this occurs pre-puberty, right? So this is not even like an adult male. But the way I want you to think of this is that if you have a child and your child is not gluten-free and you're trying to raise a healthy young man, one of the things that we know, especially in the celiac disease community, is that puberty can actually be delayed. Think of gluten as a puberty blocking drug, if you will, and think of your young son trying to mature and trying to develop. And so gonad atrophy is a symptom, an early onset symptom pre-puberty of gluten exposure. We know that gluten can also directly impact semen quality. It's been shown to cause both a lower quantity of semen production by men, but also poor motility, meaning semen that don't swim very strong, don't swim very well. So it can affect both quantity and quality of a man's semen. It can affect the potency of a man's erection, so impotence or lack of ability to maintain or sustain an erection. It can cause decreased sexual activity and loss of libido, loss of drive or desire. So again, these are symptoms in adult, except for this first one, these are symptoms in adult men, these are symptoms in adult females. Now, that being said, let's throw this up on the board. I want to show you a couple of research studies again that have come out here. So you can see here, this was published, and this is not new. This was actually published in 1994, but there's now substantial, this was 1994. So again, going back almost 20 years ago, substantial evidence that celiac sprue is associated with infertility. So it's not just sex and sexual pleasure, but also fertility, the ability to bear children. And if we look at fertility rates in the United States especially, or other industrialized countries, fertility rates are dramatically dropping, right? We're seeing more and more men and women having to go to fertility experts and specialists just in order to conceive. And so one of the most common causes of unexplainable infertility issues in men and women is gluten. So you can see infertility both in men and women. In women, it can also lead to delayed menses or menarche, and so again, think of this in terms of your children. And maybe you're already an adult, but think of this: if you're gluten-free and you've got minor children in your house that aren't but should be, how it could be impacting them, not just in their pubertal development, but also as it catches up with them in adulthood, the diseases that can be associated with that. So delayed menses, amenorrhea, early menopause. I see this a lot in women that think they're going through menopause. They end up changing their diet. They get the gluten out of their diet, and then their cycle comes back for several years before they actually go through menopause. Again, so early menopause, side effect of gluten exposure. Recurrent abortions, and this is spontaneous abortion, so the body-induced abortion, and a reduced pregnancy rate. In men, it can cause hypogonadism and mature secondary sex characteristics. Now think about that in terms of what we're seeing today. There are a lot of things that are impacting the mental health of our young men, but young men are becoming less manly, and many of them, there are all types of new terms. I don't really want to get into that whole LGBTQ thing, but we're seeing a lot more impacted, and some of this impact is in development. It's in the way we're feeding our children, the pesticides that we're exposing our children to. And so again, but immature secondary sex characteristics, meaning they're not developing sexually, and a reduce in semen quality. So these things have all been studied. The mechanisms are in debate, and some of those mechanisms have to do with malnutrition, or at least it's thought they have to do with malnutrition. We'll talk a little bit more about that in just a minute. We also know one of the mechanisms is hyperprolactinemia. Prolactin is a hormone produced in the brain, and it's seen in 25% of people with celiac disease. And this hormone elevation can cause impotence and loss of libido, gluten withdrawal, and correction of deficient dietary elements can lead to a return of fertility both in men and women. So again, these are all findings, medical findings in the research. Now here's another study I wanted to point out. Male gonadal function in celiac disease, and this was published in 1982. So again, this study is not new. This has been around for a long time, but in this particular study, 7% had clinical evidence of hypogonadism. So 7% of the celiac patients in this study all had hypogonadism, but impotence and decreased sexual activity occurred more commonly, meaning that the smaller percentage of hypogonadism, but a greater percentage of impotence and decreased sexual activity. Okay, improving after gluten withdrawal. And in the married group in this study, 19% had infertile miscarriages, a value greater than expected in the general population. The analysis of semen, so seminal analysis in celiacs revealed marked abnormalities of sperm morphology, meaning shape, and motility, meaning capacity to swim robustly. But only the former appeared to improve after gluten withdrawal. So again, improvement after gluten withdrawal. Sperm motility was markedly reduced, and 2 of the 3 celiacs with infertile miscarriages. So 2 out of 3. So again, we know gluten has a major impact on sex, on the ability to have children. We know it has the impact on the actual development sexually and the maturation, so the sexual development of both men and women, gluten can impact. Now, beyond that, let's look at some of the reported symptoms in women. These are all reported in a recent research study. Women with gluten sensitivity, 50% experienced some degree of sexual dysfunction. 61% had low sexual desire. 46% had arousal disorders. 39% had lubrication problems. 49% were unable to have an orgasm, and 95% experienced pain upon sexual intercourse. So this, again, in a recent study published showing the symptoms of what women struggle with who have gluten issues. Now, I put this diagram up here. This is from a brand new publication here, just here recently in the last few months, showing what, this was a review study published, and what they were trying to illustrate is that these areas that you see here, these big areas, are what are called non-celiac or extra-intestinal manifestations of gluten exposure, meaning these are ways that people can be impacted by gluten outside of the GI tract. So, not the pain in the gut, not the diarrhea, not the gas, the bloating, the intestinal discomfort, but symptoms showing up in other locations of the body. So one of those was the endocrine system, and specifically thyroiditis. And so what happens to women when women are diagnosed with Hashimoto's, oftentimes that diagnosis is associated with a series of different symptoms, and some of those symptoms have to do with sexual function. We know that hypothyroidism, women with hypothyroidism are tired. They generally have a lot more aches and pains, muscle aches and pains. They don't sleep as well. So how primed is a woman going to be to want to have sexual intercourse with her husband or significant other if she's battling and struggling with an endocrine disease induced by gluten, even outside of the GI tract? We know that there are skin disorders, urticaria, alopecia, we have psoriasis, rosacea, vasculitis. There are a number of different skin-based manifestations, and a lot of these are painful manifestations, meaning they hurt. So again, one of the hallmarks, I know this is maybe going to sound cliche, but fellas, if you're listening, the old cliche excuse that a wife will give to not want to have sex, which is, not tonight, honey, I have a headache, right? Not tonight, honey, my skin hurts, right? My muscles ache because of my thyroid problem. I have nerve pain. This is another manifestation of, where'd we go here? Another manifestation of gluten exposure is neuropathy. And so, when you have, again, skin inflammation, neurological inflammation, look at the symptoms. Not tonight, I have a headache, right? That migraine headaches are highly linked to gluten exposure. Look what else is linked. Depression, right? And this is another common symptom associated in those that do not want to engage in sexual activity. Anxiety. What is this, anxiety? So this is an increase in the sympathetic nervous system, right? So you think about, where do we want to be with, neurologically speaking, for sex? We don't want to be here. Sympathetic is fight or flight. And when you're thinking about things that stress you out or that scare you, this is not the time that you want to sit down and have a relationship with someone else. So you want to be in what's called parasympathetic nervous system tone. This is, again, parasympathetic is sex, digestion, rest, right? This is the aspect of our autonomic nervous system where all these things are promoting and working better. Whereas if we're stuck here because we're creating neurological damage that's driving the anxiety process, we never get into this mode, or we never effectively get here. And so it robs you of sexual vitality because it's taking you out of that nervous system mode where sex lives, in essence, right? And so we also have liver damage that can occur as a result of gluten exposure. So gluten-induced hepatitis, which, think about that in terms of toxicity. If your body's liver is struggling to detoxify, you're trying to, every day you're exposed to toxins. Every day your body is being asked to deal and cope with environmental toxins, food-based toxins, etc. And if your liver's being overwhelmed by your food choices, how well are you going to take out the trash? And if you're not taking out the trash very effectively, how much do you think that's going to impact your health in multiple ways? And then again, reproductive system, we've mentioned this already, but infertility and sperm abnormalities in men. So again, these are all just ways that gluten has been shown to impact a person beyond the GI tract that are linked to your healthy and vital sex life. So you definitely want to look at gluten as something that you want to take very, very seriously if you want to have a serious sex life. Now, before we get into some of these nutritional deficiencies, I also wanted to talk a little bit about, let's move that out of the way. Also wanted to talk a little bit about some of the other properties of grain, not just the gluten aspect, because we focused so much already on gluten, but I want to focus a little bit on some of the other things that are found in grains. One being pesticides, another being something called a mycotoxin or mold toxins. Number 3, excessive omega-6 fatty acids. And the reason why I want to talk about these 3 is, again, going beyond gluten, is that they can also impact or affect your sex life. And so pesticides, many of these mimic estrogen. So guys, this is going to definitely impact your ability to have sexual function. Ladies, this is going to create a problem for you because hyperestrogenism has been actually linked to sexual dysphoria, dysfunction as well in females. So anytime you're being exposed to chemicals that have hormone-inducing effects, in this case the mimicking of estrogen, you can really implode your sex life. And then we have mycotoxins. There's one in particular called zearalenone. A lot of times it's abbreviated as Zen. It's a mycotoxin produced by a type of mold called Fusarium. And this particular mycotoxin is also an estrogen mimicker. And so it also has been shown to create problems in both men and women in terms of sexual function. And then we have omega-6. Omega-6 fatty acids, when your diet has so what should your omega-6 to omega-3, so if we're talking about omega-6 to omega-3 ratio, should be somewhere in the neighborhood of 4-to-1, at least 4-to-1, meaning for every 1 omega-6 you eat, you should eat, or for every 4 omega-6 you eat, you should eat at least one omega-3. Most Americans are somewhere here, 16-to-1 or higher. And when I test people in my practice, a lot of times we're seeing 30-to-1 ratios in a lot of these individuals. And a lot of them don't want to have sex, right? Their sex life is almost non-existent. Their libido's on the floor. They just really could care less. And this has to do with vascular flow, because high levels of omega-6 actually can drive up the inflammatory process along with low levels of omega-3. And when you don't have a good balance there, then blood flow and the endothelial dysfunction is absolutely affected. And this is going to make blood flow into the clitoris and blood flow into the penis diminished. And so it's going to affect sexual quality, but also sexual desire. So these are 3 other components to grain. So some people say, well, I'm not gluten sensitive. I don't need to be worried about grain as a food. Well, you do, especially if you're eating grains that are bucked up with pesticides and mold toxins. And by the way, grain is the #1 source of mycotoxin in the human diet today. It's the #1 source, especially in the U.S., where we don't really have this great measuring and monitoring system in place to measure for mold toxins in the food. So this is a big one if you're eating grain. And then, of course, the omega-6, omega-3 ratio of grain is super high in omega-6. So when you're a heavy grain consumer, you're getting massive quantities of omega-6, very, very low levels, if any at all, of omega-3, driving up vascular dysfunction. Now, we could also argue in today's modern American diet, we could add number 4 to this list over here, and that would be excessive carbohydrate consumption. Excessive carbohydrates lead to insulin resistance. And insulin resistance, as a whole host of different vascular problems that come with it, that can lead to erectile dysfunction and vascular flow, proper vascular flow into the sexual glands and organs. So again, the excessive carbohydrate component, which drives insulin resistance and diabetes, is just another fourth. We'll put that as icing on the cake for something else that can also cause poor sex function that has nothing to do with gluten, but everything to do with grain. Okay. One of the other aspects to gluten exposure into poor diet in general is malnutrition. And we know that gluten can impact a person's GI tract and cause vitamin and mineral deficiencies. And we also know that many of these vitamin and mineral deficiencies can impact the quality of your sexual function. And so this is not a comprehensive or exhaustive list by any stretch, but I wanted to point out a few very, very strong research correlation. And so vitamin D has been being studied more and more of late. And so we know that vitamin D deficiency can cause sexual dysfunction and erectile dysfunction in men. It's needed for adequate blood flow to the penis, and it's crucial for sexual activity. And there are a number of different mechanisms behind it. But we do know, I think the last study I read showed that 60% of those at diagnosis with gluten sensitivity at the time of their diagnosis had vitamin D deficiency. And a good percentage, even a year after following a gluten-free diet, continued to persistently have vitamin D deficiency even after changing their diet. So this is a simple one that you can measure. And that's one of the reasons why it's on the board tonight, because if you haven't asked, if you're struggling sexually, and you haven't had this measured, ask your doctor to measure your 25-OHD. And what you're shooting for is for that value to be at least 50 nanograms per milliliter in the blood. And so that's kind of what you want to ask them to measure it, because if it's not at least 50, and the reason why I say at least 50 is the reference range for these tests. A lot of times the reference range, depending on the lab, will go as low as 20. So in essence, they'll tell you 20 is normal, even though 20 I would consider to be very, very deficient. Anything really less than 50 I would consider to be deficient. But most doctors, you'll have, your level might be 21 or 25 or 30, and they'll tell you it's fine, and they'll tell you it's normal, even though there's a tremendous benefit to getting your level above that 30 and into that 50 range. So again, know that so that when you get it tested, you can appropriately respond, either through supplementation or through getting additional foods that contain vitamin D or getting sunshine. Omega-3 fatty acids, which we talked about a minute ago, grains are very poor food sources of omega-3 fatty acids, almost non-existent in grain as a whole, as a food. But the importance of omega-3 fatty acids, they increase endothelial nitric oxide production, which is what causes the vessels to dilate. And this is true of men and women. So like women in the clitoris, which is gorged with blood during sexual arousal, is kind of synonymous to the penis being engorged with blood. And that area needs to be engorged with blood. And the way that happens is through nitric oxide production. And so you want the nutrients present that will help you produce this compound to help with arousal and stimulation. So again, this is not just for men, it's also for women. We know that vitamin B3, there's studies on vitamin B3 that show all by itself to just give extra vitamin B3 or niacin can enhance erectile function and performance in men. And then we also know that vitamin C, E, folate, all play a role in that same molecule right here. You'll see this over and over again, this nitric oxide. What's happening? Nitric oxide is necessary for erectile function as an overall as an overall chemical in that process. So hard to maintain good function without it. Now, a few other things that we've got here, just a couple of research studies to show you the impact of hypomagnesium. So this is a research study on magnesium deficiency, and this is in elder adults. But low levels of magnesium in the elderly and patients, especially with moderate and reduced kidney function. So what reduces kidney function as a general rule of thumb? high blood sugar, right? Too much blood sugar, diabetes or prediabetes can damage the kidneys. We know that gluten can damage the kidneys, but beyond that, magnesium deficiency, magnesium itself improves or helps to improve erectile dysfunction in these types of individuals with stage 3-4 kidney dysfunction. Niacin, as I mentioned earlier, so niacin alone can improve the quality or the erectile function in patients suffering from moderate to severe ED and dyslipidemia. So again, nutrients are very important for how your body is supposed to do its work, right? And sex is one of those functions. And so if you are years into gluten-induced damage to your GI tract, causing malabsorption, causing poor digestion and micronutrient deficiencies, then what ultimately is going to end up happening is your body's not going to have the baseline ingredients that are necessary or needed for it to do what it needs to do. Now, one of the nutrients that I left off this list, but I think I should probably add it, is zinc. There have been a number of research studies showing that zinc improves sexual function, and one of zinc's roles is actually in the proper metabolism of sex steroids, estrogen, and testosterone. So zinc would also be very, very important as a nutrient for you to tap into. So those are some of the main nutrients that I want you to be aware of that are critical for sexual function and sexual arousal. And when we come back from the break, I'm going to take all of your questions. We'll be right back. Ultra MG. This premium blend of 4 types of synergistic magnesium was designed for optimal metabolic support. Recent studies by the Department of Agriculture show that almost 80% of Americans are magnesium deficient, and the problem is even greater for those with gluten issues. Your body is incapable of producing magnesium on its own, yet it's required for hundreds of enzymatic systems that regulate biochemical reactions in your body. Magnesium is involved in helping your body convert food into energy, creating proteins from amino acids, creating and repairing DNA and RNA, contributing to the structural development of bone, contraction and relaxation of muscles, regulating neurotransmitters, just to name a few. The key to increasing magnesium is proper absorption. With Ultra MG, your body will receive the forms of magnesium right for you, and the synergy of the 4 magnesium forms increases the body's ability to absorb the supplement properly. Ultra MG Premium Magnesium delivers its highly bioavailable magnesium forms as ionized glycinate, ascorbate, citrate, and C16 and 18 alkyls for maximum absorption. Like all of our products, Ultra MG is gluten-free. It also doesn't contain wheat, any dairy products whatsoever. It's free of soy, it's free of yeast, and any GMOs, preservatives, or other additives. Now, for daily use, take 3 capsules a day in divided doses with or without food. If you're looking for enhanced performance, you can take 4 to 6 capsules a day in divided doses with food. If you're looking for sleep support, you can take 2 capsules 30 minutes before bedtime. And if you're looking for support of your bowel function, take 6 to 8 capsules a day in divided doses with food. And as always, consult your healthcare provider to discuss your specific medical needs before you start a supplementation program. Hey, welcome back. Now we're going to be taking your questions on gluten and sexual dysfunction. We've got a lot that have come in so far. So question 1 on the board here, Dennis is asking, is it true that cortisol lowers testosterone? And the answer, simply put, is yes. It's absolutely true. And so this, let's delineate, because this is especially true of prescription cortisol. So high doses of cortisol over time, we know lowers the production of testosterone in humans. We also know that cortisol, there's some other effects. It increases blood pressure, which was also going to affect you sexually. Elevations in blood pressure can create sexual dysfunction in many ways. We know that it's going to increase blood sugar. An elevation in blood sugar is going to affect blood viscosity, or the thickness of your blood, and that when that's impacted or when that's affected, it puts more pressure on your vascular tree. Again, this part of this is the blood pressure problem, but the other aspect is your heart has to work harder to pump that blood to the distal tissue. And so these are just some of the side effects of cortisol. Cortisol also, as it lowers testosterone, it reduces your muscle mass. And, if we're talking about reduction in muscle mass, one of the things that, especially that's healthy and important for men, is that the more lean muscle mass you have, right, the better off you're going to be with your testosterone. So if you're taking prescription cortisol for whatever reason, maybe it's to lower pain, a lot of doctors will dispense cortisol to reduce pain, like joint pain, etc., or muscle pain. And if they do it long term, and it's not so bad if it's a one-time dose, very short term. But when you're going back over and over, taking oral taking oral cortisol on the regular, you're going to reduce your muscle mass, you're going to increase your blood pressure, increase your blood sugar, and you're going to wreck your sex life. And then when you get to a point where your muscle mass is so low and then you try to go back and exercise, you're going to get injured, and then you're going to be in pain again, and you're going to be kind of following this, chasing your tail. So that's one element of cortisol. Now, you may not have prescription cortisol, so let's just remove the RX from that. And let's say that you're over-consuming gluten and you're gluten sensitive. That cortisol is going to go up to supraphysiological levels. And the reason why is cortisol is basically it's a hormone that helps your body cope with inflammation, helps you adapt to inflammation. It kind of, in a sense, what it's designed to do is it's designed to help you fight inflammation. That's why doctors prescribe it as an anti-inflammatory. And so what happens is if you're chronically inflamed because of your dietary choices, your cortisol is going to go up much in the same way as it would go up if you were taking artificial cortisol from a prescription drug. And these same impacts you're going to have, the increased blood pressure, the increased blood sugar, the reduction in muscle mass, and reduction in overall testosterone production. So cortisol is a bad idea. Cortisol is a catabolic stress steroid, and we only really want to have high levels of cortisol when we're under acute stress. And so this is one of the reasons why chronic stress is such a killer, because it leads to heightened levels of cortisol over expanded periods of time long term. That's just a bad idea. You don't want that. So hopefully that helped you out, Dennis. Let's see here. Can gluten be a reason for erection problems with condoms? Not sure I understand the exact nature of the question. Are you talking about, are you asking me if condoms contain gluten, or are you asking me if on top of condoms, if gluten can also pose a problem for erections? And I just take the condoms out of that equation and just answer it very simply, that gluten can definitely be a problem for erection, for full erection. Let's see here. Not tonight, honey. I'm stressed from work. Check back tomorrow night. Hopefully I'll be back to normal. Yeah, that's somebody's commentary. That's a common, again, cliche, but it's true, right? Let's see. How come I only get migraines when I eat cheese or chocolate? Because cheese and chocolate contain different compounds that are probably migraine triggers for you. Very curious about the LGBTQ thing. I personally feel transgender since a little child, but have never done anything about it. I just identify as a lesbian now, but I just found out I am gluten sensitive. So I'm curious on your thoughts. If there is a relation to how my brain feels, is it really my choice and it's nothing I feel like I can control? So yeah, I mean, yeah, we don't know, Laura. That's the whole thing. I don't want anybody in the LGBT community to feel like what I'm saying is that because you ate gluten when you were developing as an adolescent, that's why you feel the way that you feel. That's not my intentions are. But I think it's important to those of us who have children that are raising those children to understand that gluten plays a role and impacts the nature of sexual development. And so certainly and plausibly, intelligently, we can state that that's something that you definitely want to be concerned with as a parent. But today, as an adult woman, whether or not that was playing a role in your development, it's impossible to go back in a time machine and understand or identify whether that's happening. But again, I just think it's important that people understand it as they move forward. What are the best conventional labs to identify estrogen dominance? Conventional labs is you would just look at estrogen and total estrogen, estradiol, estrone, and estriol. Those are the four primary types of estrogen that the body produces, and you want to look at all of them. You'd also want to look at a compound called SHBG, sex hormone binding globulin. Also very important to look at. Elevations in sex hormone binding globulin, SHBG for short, can cause a binding of sex steroids or sex hormones and create dysfunction in that way. But looking at estrogen through those four, E1, E2, E3, and total estrogen, but also looking at progesterone and also looking at testosterone, all those things are important to look at if you're really trying to get an understanding of what your sex hormones are doing and trying to get an identity on whether or not there's an estrogen to progesterone ratio abnormality leading to the symptoms of estrogen dominance. Can non-alcoholic fatty liver cause vitamin D supplementation intolerance? I feel more spacey taking vitamin D supplement. No, I would say not in my experience. That's not to say that it may not be happening to you, but in my experience, fatty liver disease is not causing a person to be incapable of supplementing with vitamin D successfully. There's maybe a lot more there to unwrap and unpack, but without more information would be hard to do. Exocrine pancreatic insufficiency underdiagnosed, potential cause for vitamin D. Okay, not a question. Is there a cutoff age at which the removal of gluten returns function back to somewhat normal? No, Barb, I like that question too, because so many people think, I'm too old, and so that's, it's beyond me. I should have this dysfunction, and I shouldn't have a quality sex life. And that, I would discourage anyone from trying to buy into that mantra, because your body can heal no matter what age you are. I've seen some amazing things in the elderly after going gluten-free. I've seen some massive turnarounds. Like I said earlier, I've seen women who thought they were already through menopause and beyond it actually regain their cycle back by changing their diet. So, I'm more of the call me the optimist, but I don't think you should ever think about age as a factor in your dysfunction, at least not as an excuse to not achieving good function. Can gluten cause difficulties in orgasms in men? Yes, that's a good question, Mike. And it's funny on the research with that, one of the issues, because gluten is known to cause erectile dysfunction, it's also known to cause vascular problems for men. And when that happens to a man, it gets in their head, right? It creates a psychological problem. So now it becomes two problems. It's a physiological problem, but it's also a psychological problem. Because once a man's sex life is impacted that way, they're going to have, in a sense, many of them will have almost like a post-traumatic stress toward having sex. And so then that stress actually impacts the quality of their sex pleasure, their sexual pleasure and desire, etc. So definitely can impact a man in that way, both physiologically and then subsequently psychologically after the fact. So Mary says, how do I ask a question? I've never been able to ask a question. You ask it in the chat box, Mary. I got your question here. If you've got questions specifically about some of our supplements, though, I would encourage you. I don't want to make this show a Q&A about supplements that you're using right now, but I also don't want to deter you from getting your questions answered. Reach out to glutenology@gmail.com if you've got specific questions about some of the supplements that you're taking, and Jessica there at Glutenology can help you out and get you those answers. Let's see here. Is it true that dark chocolate is essential for good sex? I would say no, it's not essential for good sex, but it can act as a type of aphrodisiac. Does gluten genetic test have the same or more detail than a wheat zimmer? Much more detail if you're wanting to know about gluten and your genetic propensity to react to it. Wheat zimmer has zero information about the genetic propensity, so I would say much more detail. How long does it take to get gluten out of your system? Gluten, in terms of eating gluten, how long does it take for it to pass through your GI tract? For most people, anywhere from 12 to 48 hours. That's how long it takes to traverse through the gut and out of you. Now, how long does it take for the gluten damage to calm down? Gluten antibodies have a half-life of 2 to 3 months, so you're looking at several months for the damage that gluten is causing to fully get out of your system. So it just depends on how you're asking that question, Stella. Let's see, let's go down on the left. My husband was diagnosed. Could that be linked to? Could Peyronie's disease be linked to gluten? Yes. It could be, and definitely worth investigating. Can DHEA help with increasing free testosterone? It can, and I've seen DHEA do really great things to help improve or boost testosterone in humans, and so it can. But the other question that I would encourage you to ask or have your doctor ask is, are there other nutrients that you may be lacking that is contributing to a lack of ability to convert pre-hormones into testosterone? So the early on, so remember that cholesterol, your body will take cholesterol and through multiple conversions will finally end up with testosterone. Are you missing key nutrients within that process that are slowing your ability to convert that cholesterol into testosterone? There are a number of drugs that interfere with that process. There are a number of nutrient deficiencies that can interfere with that process as well. Okay, let's see. Can gluten increase prostate problems? Yes. Where I've seen that be the case, particularly, Gene, is where gluten is creating an issue with malnutrition, and so like selenium deficiency and zinc deficiency I've seen linked, and I've seen really great things in men who've had benign prostatic hypertrophy and through the right supplementation have seen great improvements in their prostate size. Is there anything that can help when you don't have any hormones? I had a hysterectomy 12 years ago. Yeah, Mary, one of the things I would encourage you to do is follow up with a good doctor who specializes in hormone, in prescribing hormones, because if you had a total hysterectomy, now if you had a partial and you still have your ovaries, you may still be making hormones, but if you had a total hysterectomy, it's a good idea to measure your levels, because if you're subphysiological, even as somebody potentially in menopause, you may still benefit from some hormone therapy, but that would be something you'd want to have measured and ascertained. Why are oysters good for increasing sexual arousal for women? Oysters are aphrodisiac mainly because of the zinc. Oysters are very, very rich in zinc, and so again, zinc is very, very important for sexual function overall. So any foods that are higher in zinc can and this is true of chocolate as well. Chocolate is a decent source of zinc. Oysters a good source of zinc. Chocolate also has some other chemicals that can be arousing in nature. Let's see here. Can gluten, I answered that one. Let's see here. So Russ is asking about copper. Would you need to check for copper as well? Copper is important. Yes. I mean, if you're doing a nutritional evaluation, and this is true, if you're trying to get a comprehensive evaluation, is to measure, don't just stop at measuring zinc or magnesium or vitamin D or omega-3. You know, you should really look at or have your doctor look at all the nutrients. Don't just stop shy. Copper is very important in an enzyme system called superoxide dismutase. And remember, for men, one of the keys to virility and healthy offspring is strong swimming and strong protected semen. So the semen are one of the richest sources of antioxidant. And so copper helps to make that antioxidant that protects and preserves semen on their swimming journey to fertilize the eggs. So if a man has poor antioxidant function, not only can that impact the viability of a pregnancy, it can impact the health of the baby, right? So we want semen with less potential for DNA defects, and that's where antioxidants are so critical to health. And so copper, being responsible for one of the most potent antioxidant systems in the body, certainly would be helpful. Do I recommend, off topic, but do I recommend eating white potatoes due to the high controversy or sugar? I'm not opposed to eating potatoes if you're not reactive to them or you're not reactive to nightshades. I think where people get in trouble with potatoes is the quantity. You know, just like with anything else, a little goes a long way. And if your idea of eating potatoes is like that big baked potato half the size of your head, smothered in bacon bits and fake butter and, and processed cheese, that's probably not a great idea. But, if you have some white potatoes now and again, I don't think that's going to be a problem unless you're allergic to them. So what do I know about bioidentical hormone pellets? I know that pellets are in my opinion, not as good of an idea if you're looking at doing bioidentical hormone replacement therapy as oral medicines. And the reason why, when you put that pellet under your skin, it's there for 3 months. The effect of the medicine is there for 3 months. So generally not removing that pellet once it's installed. And if the dose is off or wrong, you could go estrogen dominant super quick, and that's not a good idea. And because you can't control the dose, you have to just wait it out. So it's, that's one of the reasons I'm not a big fan of the pellet over the oral medication. So again, that's something you would talk to your doc about, but that's one of the reasons why pellets can be problematic. I get a lot of people that come to see me, they're on those pellets and they're so over medicated. It's unbelievable. It's almost malpractice how over medicated they are sometimes on the pellets. It's not to say that everyone with pellets has that problem, but it's common enough. Can having neuropathy affect the ability to orgasm in women who have celiac disease? Absolutely, it can. Neuropathy, especially depending on where the neuropathy is, there are different types of neuropathy. There's peripheral neuropathies, there's central neuropathies. It can impact. Remember that sexual function is a combination of how your nerves communicate to the tissue, how your endocrine hormones communicate to the tissue, how blood flow reaches the tissue, right? It's all of those things. And so if the nerves for you are damaged and not communicating well, it's certainly going to impact your sexual pleasure. Can veganism negatively impact sexual life and or sex hormones? It's a great question, and the answer is absolutely it can. If you're on a vegan diet, but a vegan diet is not the right diet for you. Is it, again, there's a lot of propaganda on diets, all diets, not just vegan diets, but all forms of diets. And so vegan diet's not right for everybody. And a lot of people make a conscientious decision to go vegan, and it's the wrong diet for them, and their health ends up deteriorating as a result of that decision. So I've seen a lot people that go vegan, and about 18 months into that vegan journey, their health is now starting to deteriorate. That's why they end up in my office, and now we're trying to repair, a year and a half or so of malnutrition as a result of picking the wrong diet and following along on the wrong diet. So it definitely can have a negative impact. A vegan diet can. You have to be careful. There's certain things on a vegan diet you're not going to get as robust amounts of zinc and copper and B12 and methionine and other important amino acids on a vegan-based diet. You're just not. And if you're not aware of that, you go vegan and you're not having those levels measured, monitored, potentially supplemented, you could end up hurting yourself in the long run. So I think more commentary on white potatoes. Not all white potatoes are GMO. Some white potatoes are GMO, but you can buy organic potatoes that are not genetically modified. So again, I don't want to scare anyone away from potatoes. If you're not allergic to them, you don't necessarily have to avoid it. But you definitely want to make sure if you are eating it that you're buying organic and keeping it reasonable. Clean sources of protein supplements. I'm a little biased there. My opinion is use either our Warrior protein or our Ultra Pure protein. If you're trying to source a really good organic protein that has a high nitrogen value, that is not cross-contaminated with a bunch of garbage and potentially even as well gluten. How does selenium affect sperm count? So selenium regenerates glutathione. It's one of its primary functions is in the regeneration of the antioxidant glutathione, which is one of the primary drivers of protection of sperm cells. So glutathione is very, very protective as an antioxidant of the quality of your sperm cells and the survivability of your sperm cells. So selenium deficiency can lead to poor, lower antioxidant function, and in that way affect sperm quality. And sperm count, because when sperm quality is poor, they die quicker, and so the viability of the sperm are not good. And this is the case with a lot of men who struggle with the infertility issues. One of the ironies I find in medicine is that a lot of times when the woman and the man are going to the fertility doctor, all the focus is on the female, right? The female goes on the hormones. All the focus on what's wrong is with the female, but in many cases it's the man. It's the man that has the problem, and then the female is actually being blamed. And so I would say if you're in a situation where you're having fertility issues as a couple, you should both be being evaluated nutritionally for guys for sperm morphology, for viability, and for sperm count. But also your overall health, your overall nutritional status, because there are more than just those 3 types of tests that infertility doctors can run that can help you understand the health and the vibrancy of your semen. And then ladies, you should also be being evaluated as well, not just pumped full of hormones. One of the terrible side effects of the fertility industry is that couples that are not capable of having babies on their own or having multiple birth babies, and they weren't healthy already. So their bodies were not allowing them to have a healthy, viable pregnancy, because your body's smart. It doesn't want you to get pregnant if you can't support a viable pregnancy. And so bypassing that with a bunch of hormones, in my opinion, it's the wrong way to start parenting. It's one bad decision that can land you into the boat of having very unhealthy children, and now you're a caretaker for the rest of your life. We see this a lot in kids that poorly develop, and the babies are born with abnormalities, mental abnormalities, and other physical abnormalities that become major burdens on a parent through the course of the parent's life, all because the parent was malnourished and wanted to rush that part of it. So I would just encourage any of you who are at that age where you're trying to think about raising a healthy family and you're struggling, have your nutritional status evaluated before you jump into all those different hormone therapies. They have a tendency to create a hell of a boatload of problems for a person in their life. So Mary asked, what if she said, I mentioned 4 types of estrogen to be tested. What if you've gone through menopause and was told only estradiol need to be tested? No, I don't agree with that. I don't know who told you that, but you really need to evaluate more than just estradiol if you're trying to get a full read on evaluating estrogen if you've got estrogen problems. Estradiol is a form of active estrogen, but I've seen cases where estradiol was normal, but estrone and estriol were not, and creating problems for people. So, and on that second part of that question, is a Dutch test an okay test to measure estrogen? It is. You can use a Dutch test to measure estrogen. You can also use a blood test to measure those things as well. Would I recommend bioidentical hormones through transdermal cream? It depends. Depends on the person, depends on the situation and the issue. Can gluten cause heart palpitations and AFib? It absolutely can. Is this a serious question? My pet turtle has been heavily, no, I'm not laughing if you're serious, but my pet turtle has been heavily glutenized and can barely move. I'm imagining like a fast-moving turtle, right? Anyway, so you got to be pulling my leg, right, on the turtle question. Red Duke said baked potato peels are healthy, but Joel Wallach says not to eat them. What should I do? I think if you haven't had your reactivity to potatoes tested and you're questioning whether or not you should eat them, get that tested first, and then you can make at least a decision that's unique to you and not just based on a generalized bit of information from 2 opposing viewpoints. Yeah, so somebody, you got me. The turtle question, I didn't think that was real. I just kept thinking of the tortoise and the hare, slow and steady wins the race. Your turtle got gluten. I don't know the biology. I'm not a vet. I don't know the biology of turtle physiology, but not that I would imagine that gluten would be super healthy for turtles. But anyway, good one. You got me. Okay, I think we're going to wrap it up. It's right on the hour. And I'm getting hungry and I want to go home and eat dinner. And you should do the same. Anyway, if you've got questions that we didn't get to tonight, feel free to forward those over to glutenology@gmail.com. We'll do our best to get them answered for you. And make sure you come back next week for another episode of Pick Dr. Osborne's Brain. If you want to get on our email list so that you're not censored and our content's not being diverted away from you, then come visit me at glutenfreesociety.org and sign up for our newsletter, and that way we never, ever, ever have to worry about censorship and the information you're asking for getting to you. So we'll see you next Monday night for another episode of Pick Dr. Osborne's Brain. Last thing, I got somebody was asking, trying to watch the master class. Mel, if we can throw that link up to the master class. If you try to watch Glutenology, the master class, and anyway missed it, we'll put a link up below this video where if you go and register, you can still watch that masterclass absolutely free. Again, have a fantastic week, and we'll see you next Monday for another episode of Pick Dr. Osborne's Brain. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.